My name's Jane Hiley. I'm a primary care school educator supporting the Integrated Care Fellowship programme, and wanted just to talk about the programme itself. It's a year-long programme. It's aimed at GPs in their first 5 years of qualifying, but also any other professional working in primary care. And it's a year-long programme where you can work together in a team with multi-professionals, learning lots of new skills about yourself, about the system, and also to work on a project together that can make a difference to the population that you're serving.
Hello, my name is Dr. Glory Echendo. I'm a GP in Norwich, which is the east of England, in Norfolk. Thank you.
Thank you. So, Glory, what have you enjoyed about being a participant on the Integrated Care Fellowship?
The Integrated Care Fellowship has been an amazing journey for me. It's been a journey of self-discovery. Being a participant here, what I've enjoyed most is being a part of a team. I've learned so much about being teamwork, about how we are different personalities, and how actually these personalities make up the team, and we all have our roles to play, and really everyone can be a leader.
Thank you. And what challenges have there been in being a participant, and how have you managed them?
One of the greatest challenges for me is having to go out of my comfort zone. Initially, I didn't like public speaking, but this put me out there. And the good thing is that we're taught how to navigate these skills. We learned a lot of skills about public speaking, making meetings meaningful, negotiation, things like this. It's shaped me in a way. It was challenging initially, but I could say that I'm a better speaker now, and I'm actually a better team player, and it's been all a good journey for me.
Excellent. And what are you planning to take away from this time and use now?
There's so much, not just for me as a GP, but also in my personal life, being a mother and also being a wife. Going from here, I'm going to be taking up another role, another leadership role, being the International Trainee Support Fellow. That would help me to support all the doctors as well. So all these skills about public speaking, skills about negotiation, skills about leadership, and how to make things work, teamwork. I hope that I will take up all these skills and help me become a better leader. And most importantly, I understand my personality now. I am a very intuitive person. I'm a thinker. So now people around me, I'm having to take courses and also know how they feel and how I make them feel, and how we move forward to become better.
Great, thank you. And what would you say to prospective participants who are considering joining the programme?
Oh, I would say come on board. It's been an amazing experience, and I can assure you that you would acquire skills that would help you to become a better leader, a better team player, and even a better follower. For me, it's been a transformative journey for me, both as a GP and also in my personal life. Just come on board. Let's make NHS a better place.
I'm Olufumilayo Adewale, a salaried GP within Norwich, Norfolk area.
Thank you. What have you enjoyed about being a participant on the Integrated Care Fellowship?
It's been an amazing, it's been an amazing opportunity, a transformative opportunity as well, because it's made me totally transform into a totally different person in terms of my leadership skills, collaborative ability, team building, and teamwork ability as well. So.
Lovely. And what challenges were there in being a participant, and how did you manage them?
To be fair, risk benefits, the benefits totally outweighs any form of risk or troubles in terms of the fellowship, because it was more than I bargained for in person.
Thank you. And what are you planning to take away from this time and use now?
Well, all the team building that I've been taught. One, I got to know my personality, how best I work, and how best to work with others, and not just for myself as a person, even for my family, my children, my partner. Just because of the Integrated Care Fellowship, we have a more beautiful relationship. And also even in my larger social environment, the church, I'm more useful because it's all about teamwork, influencing others, I've been able to touch their lives in ways more than I ever imagined. So yeah.
That's really nice to hear. How do you see your participation impacting your future?
Ooh, it's already impacting my future. So moving forward, I was able to get into a training program director role just because of this integrated care fellowship. So I always totally recommend it for everybody, because the way you talk, the way you see yourself, the way you work with others, how open you are to reaching common ground, all those were being taught. And I can't end this without saying a big thank you to the amazing Judy, because in my work as a TPD, it's about coaching others, all our interactive sessions, breakout sessions, thinking pairs are things I'm hoping to take away as well.
Thank you. And is there anything else you would say to prospective participants who are considering joining the programme?
They should. It's going to make an absolute difference to the way they practice their life holistically. So I would say it's an holistic program, and it's not just for GPs, even the other primary care team. We're evolving into multi-agency team within the neighborhood, so we're beginning to work more and more together, and there is no better time to harness that leadership opportunities, leadership skills more than now. So I think they should get on to the program.
Hi, my name is Ian McKenna. I'm an emergency care practitioner paramedic working at GP surgery in Ipswich.
What have you enjoyed about being a participant on the Integrated Care Fellowship?
I didn't quite know what it was about to begin with. Little intimidating when you see all the GPs and your peers turning up, but actually it was a way of trying to make a change to the way we work and looking at ideas. And having been in the NHS for 33 years, change is what we need. We need to move forward with the times. So I was hoping that with a team or with the group of integrated care fellows, we could look at something that would improve our primary care network.
And what challenges were there in being a participant, and how did you manage them?
The challenges was miles apart where we all lived. Thank the Lord for Teams. We were able to communicate. We did weekly, and it was difficult because the surgery wants you to be at work. So I had to negotiate with them so we could have Thursdays off. That was difficult. Some of the project we did, which was suicide prevention, was already in place. It was working out which area we needed to work on. So as a team, even though I was a paramedic and they were GPs, we actually had no rank as such, and we worked very, very much together as a team of the same people.
And what are you planning to take away from this time and use now?
I'm taking away a lot of things, personally as well as professionally. I feel now I can go to meetings and feel confident in whether that's managing the meetings or being a participant in it. It's made me more confident to be able to speak to people in groups where I was quite nervous before. And the course has made me look at how we can improve things by teamwork, which is something that sometimes the NHS lacks. And I think from the ground up, not being a manager, we can make a difference.
And what would you say to prospective participants considering joining the programme?
I would say join the programme. It's a great way of learning from a self point of view as well as a team point of view. You can make a difference, and the topics you choose as a team, you will get through. It will certainly help you from a personal and professional level.